This is an old wives' tale and it's untrue. When it comes to taking care of your smile, there are lots of misconceptions out there. While good oral health can be achieved in just minutes a day, the wrong practices can cause irreversible damage. I have put together a list of common dental myths and why you should not follow them. Hi, this is Denta Chinwag with Amaka Igwatu. Today's video will be debunking those myths. Make sure you wet the toothpaste before brushing your teeth. Wetting your toothpaste is not necessary because it can dilute the toothpaste and therefore reduce effectiveness for cleaning your teeth. Brush your teeth nice and hard. There is absolutely no need to scrub your teeth hard while brushing, because it can damage your tooth surface and cause your gums to shrink. I recommend soft to medium bristled toothbrushes. You only need to go to the dentist if your teeth hurt. Have you heard the famous saying that goes, prevention is better than cure? Even if you're not experiencing any dental pain or symptoms, the recommendation is to visit the dentist twice yearly or as advised by your dentist. Some dental problems can be pain-free, but can still cause infection requiring treatment. If you decide to delay, the treatment may be more expensive and the tooth may have a lesser chance of being saved. Flossing can create spaces between your teeth. Flossing doesn't create spaces between your teeth. In fact, it helps prevent decay between your teeth. When you floss, you're removing food debris around your gum and between your teeth, which help keep your teeth healthy and remove harmful bacteria. When you floss and your gums bleed, it's best to stop. No. When you begin a flossing routine, you may experience bleeding gums, but after a few days of regular flossing, the bleeding reduces or stops. Improper use of dental floss may cause gum bleeding, but the most likely cause is due to gum inflammation caused by bacteria and plaque. Not cleaning between your teeth means not cleaning 35% of your teeth surfaces. Make flossing a habit and inflammation and bleeding will resolve with time. When you floss and your gums bleed, please don't stop. Meals become tasteless with too much brushing. The recommendation is to brush your teeth twice daily. There is no evidence that suggests brushing your teeth can affect your ability to taste. Provided you are using good quality toothbrush and toothpaste, your meals should taste good. Flossing is not necessary. Forget flossing, it's not useful. I totally believe in flossing because it makes sense. There are builds-up between your teeth that only an interdental cleaning aid like a floss can take care of that. And I see the difference every day, so flossing makes a lot of sense. I brush my teeth all the time, so they are healthy. Good home care is encouraged. However, regular visits to your dentist is advised because they may spot something you're not aware of. You don't need to take your child to the dentist until their adult teeth appears. This is a big no-no. In the UK, the recommendation is dental checkup by 1. Children should see a dentist as soon as their first teeth come through. This is usually between 6 and 9 months and before their first birthday. This will get them to a healthy start and they can get used to the dental practice visit from an early age. The other advantage is the dentist would offer you advice and guidance while answering any questions that you may have while you're there. Charcoal toothpaste is better. Charcoal toothpaste is marketed for whitening, but in reality it offers little protection for teeth because it absorbs the protective agent meant to keep your teeth healthy and strong. While charcoal toothpaste has become something of an Instagram trend, brushing with it may actually put your teeth at risk. The charcoal toothpaste available do not contain enough fluoride. And if you remember, fluoride is one of the most important ingredients in a toothpaste. So when you're choosing a toothpaste, make sure it's from a reputable manufacturer and it has got the right amount of fluoride for your age. Hot water and lemon is the ideal morning drink. Lemon in hot water is a popular morning drink in place of tea. This is because people are worried about the tea staining their teeth. Unfortunately, lemon is more harmful to teeth because the acid in the lemon can erode tooth surfaces. It doesn't matter what time of day I brush. While we recommend brushing your teeth twice daily, brushing at a certain time does have an impact on your oral health. At night, when we sleep, saliva production reduces, but during the day, saliva flow is higher and it provides a cleansing effect that we don't get at night. When we don't brush at night, food particles sit on our teeth all night long and contribute to dental problems over time. And brushing in the morning not only fight decay but also help fight bad breath. My teeth health is not connected to the rest of my body. Your oral health is very connected to your overall health. An unhealthy mouth is more likely to cause bacteria to enter into the bloodstream and result in other health problems. Studies have found a link between gum disease and diabetes, cancer, kidney, and heart diseases. Electric toothbrush is better than manual. You can have good oral hygiene with both a manual and electric toothbrushes as long as you use them properly. Guide the toothbrushes where they need to clean and brush for 2 minutes twice daily. Women lose one tooth for every child they give birth to. This is an old wives' tale and it's untrue. Hormones associated with pregnancy can exaggerate bacteria in the mouth and can cause teeth and gum problems. Regular dentist visits during pregnancy can help greatly. If you experience morning sickness, avoid brushing your teeth straight after vomiting. Instead, rinse your mouth with water or fluoride mouthwash and wait at least 30 minutes before brushing your teeth. Rinse your mouth after brushing your teeth. No, spit, not rinse after brushing your teeth because toothpaste contains a lot of useful ingredients for protecting our teeth throughout the day. Our teeth are like sponges and they absorb all these helpful ingredients in the toothpaste even after you finish brushing your teeth. Just spit away any excess toothpaste and do not rinse. Coconut pulling can make teeth healthier and whiter. Coconut pulling involves swishing coconut oil around the mouth for 10 to 20 minutes and is supposed to have a range of benefits. There is no scientific backing to this claim. If you have tooth decay or want whiter teeth, go and see your dentist. Teeth scaling weakens teeth. Remember, your teeth has many enemies, but tooth cleaning is not one of them. Scaling removes calculus and sticky plaque that your usual home care routine cannot deal with. So teeth scaling when needed is essential for maintaining healthy teeth and gums. You shouldn't change your toothbrush every 3 months if it looks good. Don't trust the appearance too much. If you've used your toothbrush regularly, it's likely the bristles are not in perfect condition and the toothbrush have been stored improperly and therefore filled with bacteria. Making it a habit to change your toothbrush or your brush head every 3 months or monthly if you have gum disease is the recommendation. Chewing sugar-free gum is just as good as brushing. Oh no! If only this was true, people everywhere would jump for joy. Chewing xylitol-containing chewing gum might encourage saliva production, which helps clear out acids from food and drinks. It cannot, and I repeat, it cannot replace brushing and flossing when it comes to plaque removal from all teeth surfaces. This is not in the scope of a chewing gum. So please do not replace brushing your teeth twice daily with chewing gum. Please don't. Professional cleaning should be done every 6 months. We recommend dental checkups every 6 months, but whether or not you'll be having a clean can only be determined by your dentist following an examination. Calculus build up in the mouth at different rates, so for some, they might need a clean every month, 3 months, 6 monthly, yearly, and for some, they might not even need a clean at all. So it's not a must that you have to have a clean every time you see a dentist. My teeth are unhealthy because I am aging. No, Aging is not an automatic factor in deteriorating oral health. Taking care of your teeth at childhood and adult years will ensure healthy teeth in senior years. In general, oral hygiene is important regardless of your age. Be sure to brush and floss throughout your entire life to keep your mouth healthy. Brush your teeth straight after meals. You should wait a minimum of 30 minutes after eating before brushing your teeth because the pH in your mouth changes when you eat, making your mouth more acidic. Brushing straight after meals moves all that acid around your mouth, potentially causing more damage and increasing the risk of teeth erosion. It's only a baby tooth. Baby teeth are very important. They are space maintainers for the adult teeth to allow them line up underneath the gum and grow in properly. It is important to make sure your child's teeth are as healthy as possible by brushing and flossing their baby teeth. In all, it's more than just a baby tooth. It is a space maintainer to guide the adult teeth into position. So please take care of your child's baby teeth. Diet sodas are okay to drink because they don't have sugar in them. Even though diet sodas don't have decay-causing sugar in them, they are still highly acidic. The acid can eat away at the enamel, causing teeth sensitivity. Every time you take a sip, the bacteria in your mouth begins to work with the acid and attack your enamel. It takes about 45 minutes for your mouth to completely neutralize the acid. So each time you sip, that 45 minutes attack starts all over again. I'm too old for braces. Absolutely not. The good news is this is not the case. Braces could be an option if you have spaces or crowding between your teeth. It's important to note that the process may take a little longer than a child's because their bones are still growing, which means that teeth can be moved more easily. You can't replace a knocked out tooth. I bet you'll be happy to know that you can in fact reimplant a knocked out adult tooth. Emphasis on adult, if the conditions are right. If you happen to knock out a tooth, handle it from the wide end and rinse it with clean water carefully. Try and place it back into the socket. If this fails, place it in a container of milk. In the absence of milk, simply place it in your cheek, but be careful to avoid swallowing it and get to a dentist ASAP. Root canals are painful. Everyone dreads a root canal due to the stories they have heard. Although the initial tooth infection can be painful, the root canal treatment itself is far from it because during treatment you will be numbed up really good to make the whole experience painless and stress-free. If you need to have a root canal done, don't put that off. Don't go for an extraction. Just go for a root canal treatment because it's not as bad as what people say. Beauty salons are a good place to get your teeth whitened. No! Teeth whitening is a form of dentistry and should only be performed by a dentist or another regulated dental professional. Some beauty salons offer teeth whitening while you wait. This is actually illegal if there is no dental professional present and can carry significant risks. Do not go cheap because you may regret it. Well, I hope that cleared a few things up. I encourage you to be proactive in keeping your teeth healthy. Putting off regular dental checkups are likely to lead to problems. A little time invested each day can save you countless hours of trouble, not to mention money in the future. If you're experiencing problems or have questions about your oral health, speak to your dentist about it or leave your questions in the comment section and I will be glad to answer them.